Hey guys, so we're going to do the last video for chapter 21. Previously, we talked about bacterial infections of the skin and eye, and in this one, we want to talk about all the other ones that aren't bacteria, so viral and fungal and helminths, any of those guys. Okay, so we'll start off with the viruses. So papillomas are going to be warts from the human papillomavirus. There are lots of different strains, lots of different warts. You have, most of us got warts as a child at some point in time. Many of us were already infected with HPV and then we fought it off. But anything from flat warts to plantar's warts, common warts, filiform warts, like we've got over here, they're all human papillomavirus. HPV can also cause cervical cancer. So a lot of us have had the HPV vaccine, which goes and protects you against, I believe it's 7 strains of human papillomavirus. It's not all of them, but it's the major ones that we know can potentially change into and cause cervical cancer. So these are human papillomas. These are warts. Again, a lot of us have had them. There are different treatments for them. To go to the dermatologist, they can freeze them off. If you buy the, what is it, Dr. Scholl's maybe, at the store, then you can, put that stuff on and it will, peel layer after layer after layer off of it until eventually, it goes away. Your immune system can tackle these things too. Sometimes it's a combination of both to try and get rid of these guys. These are warts, papillomavirus. Herpes virus is the cause of this thing. So this is a cold sore. These things come and go. Herpes virus is with you forever. If you get it, it can be this one, like these cold sores. If they are active, they can absolutely transfer to somebody else. Between individuals, when you have an outbreak, they can actually transfer when you don't look like you're symptomatic too. Herpes is sneaky like that, and it sticks with you. HSV1 is going to be the oral herpes. HSV2 is typically when we think about the STD herpes, but both of them can be in either place. It just likes mucous membranes. So you can have HSV2 on your mouth. It is possible, but in general, HSV1 is going to be our cold sores as a source for those who has had cold sores. You can potentially treat these to, you cannot cure it, of course, you can't cure herpes virus, but you can try and treat these symptoms. So there are topical creams that you can get to reduce the symptoms and reduce your cold sores. More viruses, roseola and fist disease. My kid got roseola and it freaked me out. So what is roseola? It starts off as a cold. Both of these actually start off as a cold. You got a runny nose, you got a sore throat, a little bit of cough maybe, and then a fever. And then days later, this rash shows up. And so on mine, it was on my firstborn, and it was on his belly, it was on his back, started going down his arms and legs, and I was, worried about him, so I took him to the pediatrician, and actually the pediatrician was closed, and I ended up taking him to emergency care, and they don't usually handle kids, and so she kind of freaked out and thought it was German measles, or maybe, something else, but it ended up just being roseola, and it took care of itself, and everything was fine, and it was freaking out over nothing. But you're a parent, and you gotta do those things. You gotta check out, make sure that your kid is okay. So it was roseola and not, the measles. His vaccinations did work, and he was fine. But it's just a little scary to, think your kid's okay and that they've kicked the the cold, and then they're covered in a rash. It's scary. Fist disease is going to be parvovirus, while roseola could be that herpes 6 or 7 for roseola, parvovirus or fist disease. So it is kind of similar. It's cold-like to start with, fever. There's going to be a rash associated with fist disease too. It starts off where it's going to have these pink cheeks, where it looks like slap cheeks is what they call it. These pink cheeks, and then it may spread to other areas. And you only really see these on kids. You typically don't have the rash for adults, but adults can get this too. I know my cousin's son got fist disease and then passed it on to mom, and she was not happy because she was having joint pain for months. And typically this is going to resolve. These will resolve on their own, usually. If it becomes severe, then you may need to go and seek treatment. It could potentially cause issues in the immunocompromised. So definitely seek treatment if this fifth disease is progressing and you are susceptible because you're immunocompromised. Oh, I left off some. Viral conjunctivitis in the eyes, because we don't have any pictures of these, but we saw a picture of pink eye before in the bacterial section. It looks the same. It's a little less gunky, a little more watery in the pus. But it's conjunctivitis. It's conjunctivitis. It's just viral instead of bacterial. So if you took those antibiotic drops, that's not going to help you with viral conjunctivitis. And then herpes keratitis. Sorry, herpes keratitis is going to obviously be caused by herpes. And we talked about HSV1 is the closer one, and it can spread up to the eye, and that'll be herpes keratitis. So this one could possibly, is going to infect the cornea and the conjunctiva, and can possibly, damage the cornea and possibly lead to blindness. So it's something that you definitely want to get looked at if you think that that is what's going on there with the keratitis from herpes. All of the viral stuff in a handy table. All right, mycoses. If you see the word mycoses, I want you to immediately think of fungal infections. Fungal infections are all called mycoses, and it'll be all over your body with all the different things, that where fungal infections can happen. And here we're talking about the skin, so these are mycoses of the skin. One of our groups are tinnitus, and tinnitus are fungal infections. It's dependent on where that fungal infection on the skin is happening, what part of your body on the skin this is happening. So if we were talking about tinea pedis, pedis means foot, this is athlete's foot. If the fungal infection was growing on the beard, barber's itch, where your beard would go, like you were shaving and you were getting it there, barber's itch. Most of us have seen commercials or heard of jock itch, because some of these things are okay in the dry areas and some of these things thrive in moist areas, like athlete's foot in between your toes and jock itch down in the groin. They thrive in those areas. If it's on your body, it's tinea corporis. Corporis body is ringworm, and so that way page 2, it tends to spread out, and so it looks legit like a worm, but it is not a worm. It's a fungus, and inside in the center it starts to heal up again. But that is different types of tinea. They are all fungal infections on the body. It just depends on where on the body it is, and the name will change, but they all start with tinnias of this group of fungal infections. So here are some handy dandy pictures of the different ones. So barber's itch is here, athlete's foot is this, and if we were talking about ringworm on the body, it's there. Antifungals can treat these things. If you have seen, you know, oh, Tinactin, Tinactin is what you would treat athlete's foot for. They are antifungals. They can take care of this. Other mycoses, aspergillus. Aspergillus is our next one. I skipped over the diagnosing the tinnitus. I skipped over another important point too. If you have a tinnitus, if you've got ringworm, something that they can do, they can, take a scraping and go and look at that underneath the microscope. They can look at it under a UV lamp. Look at it under the UV lamp, take that scraping under there and see, is it, a fungal infection, or is this something else? So we can definitely diagnose tinnitus. Aspergillus, trying to jump the gun and get to aspergillus. These guys also, we said that bacterial anthrax can leave an eschar, and here we have another one with fungal. So aspergillus can cause aspergillosis. Usually it's going to be respiratory. When we get to the respiratory system, we talk about aspergillosis. It gets into the lungs, and then it starts to become systemic throughout. This one's pretty rare to see it on the skin, but it can happen. Secondary cutaneous aspergillosis. And these guys are opportunistic, kind of like Pseudomonas that we were talking about earlier. And they'll like to take over places that are already wounded. If you are recovering from surgery and you've got a wound like this, a bandage in place, it may come in and take advantage of that situation. Other different fungal infections, Candida. Candida is one of those biomes. We are covered in bacteria, we are covered in viruses, we are covered in fungal colonies. So with this guy, this is candidiasis. And this is where you've got the infection from Candida, and it has decided to take advantage in different places of the skin. Sometimes it may get in your nail bed, and it leads to yellow, brittle nails on those toes, like we've got a picture of there, and then we can see it growing over there. Usually, all of these guys can be treated. Toe fungal infections take a while because you literally have to wait for that healthy toenail to grow out as you are taking the medication to treat the toe fungus. To treat the toe fungus, but treatable. These are treatable. Sporotrichosis is going to be rose thorn disease, gardener's disease, where you have been, stuck by thorns or some sort of, small scrape or something like that as you were doing landscaping. And these guys can be superficial, they can get underneath, be subcutaneous, and then spread that way. Usually it just shows up as a small ulcer at first, but then it can spread through the lymphatic system. We want to diagnose this early, and then we can treat it with antifungals. All the different mycoses of the skin. Last category are our protozoans and helminths of skin and eyes. So first one is acanthamoeba, and it has amoeba in the name, so it's an amoeba, and it's going to be in the water. And we can pick these guys up from swimming in unchlorinated bodies of water if the chlorine level has gotten low. This can happen in in swimming pools and other areas. People have picked this up. It can, we're talking about, skin and eyes. It can infect the eyes. It can also spread to other places. So it can spread to the nervous system, um, and that can be fatal. But that is very, very rare. But right now, we're just talking about skin and eyes, and not the amoebic encephalitis. But we can pick these guys up again in unchlorinated water if we are hanging out, swimming out around. We can pick up amoebas. Here's what it looks like when it can damage your cornea. You can see that corneal damage just glowing yellow there when we are trying to diagnose what's going on. Contact wearers, again, be safe, clean them, wash them, make sure you're taking care of your eyes. Low worm or loiasis is going to be our last one. This is African eye worm. It's as gross as it sounds. These guys will get they migrate in the conjunctiva of the eye, and you can see them going through the tissues. It is going to be common in Africa and only Africa. It is endemic to Africa. We won't see this unless somebody has gotten it there and traveled someplace else. It's spread by deer flies that bite you and take a blood meal, and this is where you will see it. So these will grow up, and you can see, I don't know if you can see this very well, but maybe you can see this, and it's traveling across the eye, and that's how you can see it and know that it's there. But just because you cut that one out does not mean that you took care of the infection. It needs to be treated with medication. Obviously, it can damage the eyes, but it can also spread and damage other organs like your heart and your kidneys too. So these are the parasites of the skin and eyes, loiasis, and acanthamoeba. That is it for skin and eyes. Let me know if you have any questions. Thanks.